5 foods that lower blood pressure at home. You may be wondering if your diet has an impact on your high blood pressure if you have been diagnosed with it. Absolutely, is the response. Dietary choices and other lifestyle factors can significantly reduce blood pressure. In fact, by making simple dietary changes, some older persons are able to lower their blood pressure. This may therefore lessen or perhaps completely remove their requirement for blood pressure medication. It is commonly known that salt, which is mostly composed of the mineral sodium, can raise blood pressure. The Centers for Disease Control and Prevention, CDC, states that Americans eat significantly more sodium than is necessary. Adults are advised by the 2020 to 2025 dietary guidelines for Americans to consume fewer than 2,300 milligrams of sodium daily. The American Heart Association suggests taking no more than 1,500 milligrams per day if you have high blood pressure. Although limiting your salt consumption is crucial, but it's not the whole story. Stack up your plate with foods that lower blood pressure to lower your risk of heart attack, stroke, and other consequences. Before we jump right into the foods that will lower blood pressure at home, please be advised that this video is for educational purposes only, and you should consult your doctor if you have any serious conditions. Unsweetened yogurt. Yogurt may help those with hypertension get better blood pressure results, according to a recent study. Its high concentrations of calcium, potassium, and magnesium, all of which are believed to aid in blood pressure regulation, are the cause of this. To make a nutritious breakfast or snack, look for unsweetened Greek and natural yogurts that may be combined with nuts, seeds, and fruits. Yogurt can be added to your day-to-day diet, and it will give you a few fundamental supplements. Yogurt contains vitamin B12, calcium, and phosphorus. It is likewise a wellspring of protein. Probiotic property of yogurt is likewise useful for well-being, as it works on your stomach-related well-being, boosts invulnerability, and some more. To add yogurt to your eating regimen, ensure that it is a low-fat yogurt with practically no additional sugar. Berries. Anthocyanins, which are antioxidant chemicals, are abundant in strawberries and blueberries. Anthocyanins have been related in studies to lower blood pressure in hypertensive individuals. There's more good news. Berries taste great. You can eat them as a sugary afternoon snack or sprinkle them over your yogurt, cereal, or oatmeal. Berries, particularly blueberries, are wealthy in normal mixtures called flavonoids. One investigation discovered that consuming these mixtures would forestall hypertension and assist with bringing down circulatory strain. Blueberries, raspberries, and strawberries are not difficult to add to your eating regimen. You can place them on your cereal or granola in the first part of the day, or save frozen berries close by for a fast and sound treat. Beets. This root vegetable is high in nitric oxide, a compound that has been displayed to diminish systolic blood pressure. Attempt beets as a side dish or add it crude to plates of mixed greens. You might actually buy beetroot juice with no additional sugar to drink all alone or add to smoothies. Sweet potatoes. Eating potassium-rich yams advances a sound heart. Higher potassium consumption permits you to discharge more sodium, brings down your pulse, and diminish your gamble for coronary illness as indicated by the American Heart Affiliation. Yams contain around 475 milligrams of potassium for each 1/2 cup cooked segment, noticed by the U.S. Branch of Farming, USDA. The Foundation of Medication proposes that grown-ups consume 4,700 milligrams of potassium every day. High vitamin A substance is another of the various advantages of yams. Vitamin A is critical for sound, teeth, skin, bodily fluid, skeletal tissue, and vision. Dietary fiber is one more useful supplement tracked down in yams. A 1/2 cup part of cooked yam with skin contains a little more than 3 grams of fiber as per the USDA. Leafy greens. Cabbage, collard greens, spinach, kale, and different greens are high in nitrates, which have been found to offer circulatory strain benefits. It's simpler to get your day-to-day portion of greens by fluctuating how you eat them. For instance, you can sauté spinach for a delicious side dish, add fennel to soup, or heat a cluster of kale contributes the stove. Spinach is a verdant green high in a plant-based compound known as nitrate, which might bring down circulatory strain. It's additionally stacked with cell reinforcements, potassium, calcium, and magnesium, which can uphold heart well-being. A more seasoned little investigation of 27 individuals found that the people who ate 16.9 ounces, 500 milliliters, of a high-nitrate spinach soup every day for 7 days experienced decreases in both SBP and DBP, contrasted, and the people who consumed low-nitrate asparagus soup. That's all for this video. Please hit subscribe for more videos like these.